Hello everyone. As a part of a pre-workshop learning for a dialysis technology update workshop that is to be held on 7th of April 2024. Today Dr. Manoj Dhanorkar, Assistant Professor, Department of Nephrology, AIIMS, Nagpur. I am going to discuss with you regarding the reverse osmosis and the dialysis machine disinfection processes. So the learning objectives of my presentations are understanding the disinfections that is used in the dialysis, external disinfection of the hemodialysis machines, internal disinfection of the hemodialysis machines and the reverse osmosis system, various disinfectants that are available, and the word on standard guidelines for frequency of disinfection. So hemodialysis machines are considered very critical items. Critical items are the objects that enter the sterile tissue or vascular system of the body. SD machines have a can cause very high risk of infections if they are contaminated by the microorganisms, and thus they must be sterile when used. So microbial contamination in hemodialysis can occur due to patient in the form of dialysis access site infection or from the dialysis machines as an extracorporeal circuit. So for these SD machines, high level of disinfection has to be achieved. So what do you mean by high level of disinfection? That means there must be a complete elimination of all microorganisms in and on the instrument except for small number of bacterial spores. As per the FDA guidelines, the appropriate disinfection of high level includes 6 log 10 kil of mycobacterium species, which is equivalent to almost like 99.9999% reduction kill of the microbes. So this can very well be understood from this diagram. Here the highest level of sterility can be achieved with the clearing of the prions, and below that is the level of sterility called sterilization, where even the bacterial spores are also destroyed. For high level of disinfection, what is important is the microbes in the form of mycobacteria, which are to be killed, and all those that are there below that level also should be killed. So now coming on to the external disinfection of the HD machines, first thing that one has to remember is that any visible contamination of the machine that should be wiped off using an absorbent material, and the disinfection of the external surface of the machine has to be performed after each patient's dialysis and even before machine is moved from the patient area to another location. Now for cleaning the monitors, one can activate the wipe screen option. Wipe down the screen with clean and dry cloth. One should also clean the side, top and back of the machine, and one must clean the exposed surfaces of the various connectors for the dialysate, connectors for the concentrates and bicarbonate. So the external disinfection has to be done with the approved disinfectant by the manufacturer. In majority of the cases, it is the 90% ethanol or a 70% isopropanol or a sodium hypochlorite in a concentration of 0.05%. So products containing benzene, toluene, xylene, acetone or similar solvents should not be used for external disinfection of the dialysis machines. Now coming on to the internal disinfection of the hemodialysis machines. So when we say internal disinfection, it is not a single operation that has to be done, but it is basically a series of operations that has to be done in a clear succession to achieve complete disinfection of the hemodialysis machines. So there are 5 steps for disinfection. First is a post-dialysis pre-disinfection rinse, which is to be followed by the cleansing. Then followed by that is a descaling. This is to be followed by a thorough disinfection, and lastly the post disinfection rinse. So coming on to the first step of disinfection is the rinsing of the HD machine. It's basically the flushing of the internal hydraulics of the dialysis machine with the dialysis water, which has a high level of standard. That means it should be bacteria and endotoxin free RO processed water. So this rinsing has to be done for a sufficient period of time with adequate flux of the water. So this will drive out the residual dialysate that is there and the residual organic matter inside the HD machine's hydraulics. It will also remove the glucose residues. So if they are not completely eliminated, while using heat disinfection, they can get caramelized and cause permanent damage to the hydraulics. Secondly, they also wash out the remnants of the bacteria and the endotoxins. However, this rinsing technique is not effective in particular areas of the dialysis machines, like the areas where there are corners, or if there is any obstruction or irregularity in the tubes, or if there is any area of stagnation in the circuit. So the second step in the disinfection is the cleansing. Now, as we all know, these dialysis machines are prone to develop biofilms. Biofilms are the slippery substances which can visibly be seen as yellow coating on the inner walls of the semi-transparent tubings. These are amorphous material which actually protect various bacteria from getting killed by the disinfectant agents. Bacteria like coliforms, pseudomonas, micrococci get protection because of these biofilms. The factors that promote this biofilm formation are the type of disinfectants. So as is seen, acetic acid and hypochlorites based agents, rather than killing the biofilms, they may enhance the biofilm formation by converting the organic material on the surface to a strong deposit. The second factor is the existence of any dead spaces. The third important factor is the low flux or interruption in the dialysis flux. These are the factors which tend to promote the biofilm formation. So these biofilms then result in the drainage blockage, and it will also lead to reduced flow of the fluids and sensor malfunction. What is important is that peracetic acid was found to be highly effective at biofilm removal both at room temperature and when heated. Now the third important step in the HD machine disinfection is the descaling. Now as we all know, we usually follow a bicarbonate based dialysis where bicarbonate are there in the basic component of the or solution B in the form of sodium bicarbonate, and in solution A there is a calcium in the form of calcium chloride in the acidic component. Bicarbonates and calcium or magnesium are poorly soluble and can precipitate as carbonates when they come close together along with the fragments of the salt of iron and organic materials. So that is the reason why both these solutions have to be mixed either in the machine itself or just before the application. Even with that, there is a chance that these get precipitated, and these precipitates then cause malfunctioning of the conducimetric pH probes and can also promote colonization of the bacteria. So what is more important for this is the descaling agents. So descaling agents like 1% acetic acid or citric acids at various concentrations like 1% when exposed for 120 minutes, 21% when exposed for 40 minutes, and 50% when exposed for 15 minutes have a very good descaling capacity. The fourth most important step is the thorough disinfection of the HD machine, which can be performed either with the help of these three systems. One is a physical system like heat, UV radiation, like that. Chemical system like chemicals, and third physicochemical, which are a combination of physical and chemical components. Now these physical system are found to be difficult for practical use. They are more expensive and sometimes they are not effective also. While chemical systems are reliable for their sterilization action, but they need very much cleaning before application, and proper guidelines have to be followed regarding their concentration, their contact time, the temperature at which they are used, and the pH at which they are used for their best actions. A third approach of physicochemical system is the best one, considering that it combines the action of both. So it is seen that an increase of temperature of 10 degrees Celsius is capable of increasing the disinfectant capacity of many of the chemical agents, even in their gaseous forms. So let's say if an example is there, like alone citric acid, it has no action on bacteria, proteins, lipids and other materials, but its action can be augmented, both descaling and disinfection actions, if when used at a 90 degrees Celsius in a 12% concentration form. So physical chemical system can be a boon. So when we say a disinfectant, it should be one would try to have a ideal disinfectant. An ideal disinfectant should be a broad spectrum, that is acting on various spectrum of antimicrobials, should be fast acting, killing microbes rapidly, should not be affected by the environmental factors like any organic material, and they should be compatible with soaps, detergents and other chemicals. They should not be toxic to the patient or the user, so that they shouldn't cause any irritant action, any accumulation or sensitization actions. They should be surface compatible, so that they should not corrode any instrument or any metallic surface, and should not deteriorate any clothes, rubber, plastic or any other material that is used in the dialysis machine. These ideal disinfectants should have a residual action when treated on a surface by forming a thin film. Also, they should be easy to use with the clear labels of directions. They should be odorless, should be economical because cost is something which has to be kept in mind while using disinfectants. They should be soluble in water and should be stable in various dilutions and concentration, should not be frothy so that be clean easily, and they should have a very good cleaning properties also, and the most important part is they should be environmental friendly. So looking at the first part of our thorough disinfection, the first thing, that is a physical disinfection, in heat and UV radiations, what we use commonly in dialysis is the thermal or heat disinfection. So this is done by heating the dialysis water to a temperature of around 80 to 95 degrees Celsius and allowing it to circulate for not less than at least 30 to 40 minutes. The flow of this water should be kept at a lower level, that is around 200 ml per minute. But the problems with this thermal disinfection is that it can cause itself or can facilitate the deformations in the dialysis machine. It can cause rupture of the plastic tubings. It can cause movements of the elements of the HD machine, causing disconnections. Also, it can coagulate on the organic deposits, or it can caramelize any glucose residue, causing permanent damage to the dialysis system. Also, they lack any action on the endotoxins. So, as we all know, the chemical disinfectants are one of the best ones. So the first chemical disinfectants that were used past was the formaldehyde. So it was used in the formulations of 1.5 to 6%. It is a very wide spectrum of actions acting on bacteria, including mycobacteria, spores, fungi, viruses like hepatitis B, hepatitis C, HIV. And they are also active in their gaseous forms, so they don't have to have a direct contact. Even without contact, they can have a very good action. But the issues with this formaldehyde is that it is easily absorbed by the plastic materials, and the repeated exposures can cause autoantibody formation in patients. Sometimes they will be difficult to manage, toxic and carcinogenic, and also can cause direct or indirect hemolysis through some immunogenic mechanisms. One must remember that while using formaldehyde, they need a prolonged post-disinfection rinse to remove any remaining traces which if left inside and not properly removed, can cause various reactions in the dialysis patients, like simple burning of the arms to cardiorespiratory failure. So that is the reason why formaldehyde is phased out. The second brother of formaldehyde is the glutaraldehyde. It's available in two forms, two major forms. The first form is acid or alkaline type, which is available in more than 2% concentration, that is around 2.4 to 3.4% concentrations. The alkaline type has a weaker odor than formaldehyde. It is not corrosive and is easily removed with water. But the only problem is that the effect is very short, of less than 2 weeks. While the acid types, they last longer again, but they are more difficult to eliminate also. But the glutaraldehyde concentration can be reduced if they are used in combination with sodium phenol or sodium phenolates in concentrations of 1.93%. So they have a synergistic action. So even in dilution, glutaraldehyde can work nicely. They are found to be very rapidly active on ample of spectrum of pathogenic microorganisms, spores, fungi, and viruses, including hepatitis B, hepatitis C, and HIV. And they also have an added detergent action even in the presence of organic material. The only problem with these glutaraldehyde formulations is that, as like formaldehydes, even with less contact time, they have a risk of absorption and release by the plastic material remains. The second one, the third disinfectant that is available with us is the peracetic acid. It is usually used in combination with peroxide and hydrogen. The concentrations that are usually available are in 0.23% of peracetic acid along with hydrogen peroxide of 7.35%, or 0.08% of peracetic acid with 1% of hydrogen peroxide. It is found to have a very rapid action against the extensive spectrum of bacteria, fungi, and viruses. It has an added benefit of descaling capacity, and it is much less toxic because when disintegrated, it disintegrates into acetic acid and water, which are non-toxic. So that is why they are the first choice for disinfecting the dialysis monitors. And also that they have no effect on plastic materials such as polyvinyl, polyethylene, which they do not absorb. The issue with this peracetic acid is that they have a reduced activity or efficacy whenever there is an additional organic residue is present. Also, they are highly corrosive when they come in contact with the non-ferrous materials, but this can be solved by using the polysulfates or modifying the pH of the solution. But the one more important problem is the flammability and the explosion risk with this chemical. So particular attention has to be taken while packing and storing this chemical. The fourth chemical with us is the hypochlorite, which is used in a formulation of 2.5 to 4.5% concentration at a pH of around 11 to 12. It has an excellent antioxidant activity, so can dissolve the biofilm rapidly due to its sodium hypoxide, and it has a strong bactericidal, sporicidal, and fungicidal action. The problem with this disinfectant is that it's a strong corrosive power, so it cannot be used for a longer duration or cannot be kept in dialysis machine for a longer duration. And again, it gets inactivated when there is an organic substance. So before using it, one must do proper washing. And also that the unstable form, it is also unstable. So the stability can be increased in a latest formulation where the electrolytic chlorine oxidant in a hypertonic solution of sodium chloride containing very traces of hypochlorous acid can remain active for a longer period. One such molecule is a amucin, which has no corrosive powers. It prevents the formation of encrustations in the hydraulic circuits and does not produce froth, so it can easily be removed. One special method of disinfection called cold sterilization or mechanical disinfection. It is a very particularly important in case we are using any online HDF machines. And here we use microfilters, also called antibacterial filters also called ultrafilters. Now these microfilters are made up of polysulfones and polyamides, and because they are made up of these molecules, they are prone for falling. Falling means the accumulation of particles, macromolecules, salts and colloids onto their membrane surface or within the pores. So these microfilters are usually two when applied in online HDF. First microfilter is usually at the entrance of the water circuit of the dialysis monitor, which is meant to capture any bacteria or endotoxin that is coming from the dialysis system, distribution system. While the second microfilter is there for absorbing any pyrogenic substances. So these microfilters also needs to be cleaned. So a method called power cycles of spilling, where automatic washing of this membrane can be done with the tangential flux or in counter current flux of the dialysis water. However, one must remember that these filters remain active only for short period of time. So one must follow rigorously the periods of their substitution for their efficient action. So if you look at the various disinfectants that are available commercially with us for hemodialysis and RO machines disinfectants, the company components like Citrosteril, Diasteril, Peristeril Plus, Peristeril 340 and Sporotal 100. Citrosteril contains citric acid, malic acid and lactic acid, which can be applied as a heat disinfection, and they also have additional decalcifying action, though cleaning action is limited, and there is no restriction on material compatibility. Diasteryl is a hydroxyacetic acid or glycolic acid, which is again useful in a heat disinfection and has a decalcifying action also. Puristeril plus is a peracetic acid with hydrogen peroxide. It acts in a cold disinfection manner, while Puristeril 340 is a combination of peracetic acid with hydrogen peroxide with which is to be used in a cold disinfection manner. The fifth one is a Sporotal 100, which is a sodium hypochlorite along with potassium hydroxide solution, and it is again used as a cold disinfection at a temperature of around 37 degrees Celsius. It has an excellent cleaning action but no decalcifying action. Now the last part of the disinfection is the post-disinfection rinse. So this is important because it removes any residual disinfectant that is there in the hydraulic systems, and this removes it by either mechanically or by dilution. It is also important for after the thermal disinfection, because thermal disinfection might have caused endotoxin formation by the germs, and these are to be eliminated post disinfection. That is the reason why post disinfection rinse is must. It should be automatically implemented, and it should be non-bypassable. So specific tests are available in the market to determine whether any residual disinfection agent is present or not. Like for chlorine, we can use a hypochlorite calorimetric test. For peracetic acid, we can use amino iodic acid test, and for citric acid, one can use UV test. Now, how many times a disinfection should be performed? So for a standard dialysis system, descaling of the hemodialysis machine has to be done daily. For a dialysis machine, disinfection should be done daily with the bleach or a heat citric acid cycles, and they can be disinfected quarterly with peracetic acid when there is a full flow through the system, when the ROs are getting disinfected using the peracetic acid. That means whenever the ROs are getting disinfected quarterly with acid or alkaline cleaners and peracetic acid, the same time they can get their dialysis machine can get disinfected. Now, portable RO system should get monthly disinfected using peracetic acid, while RO distribution loops, if they are heat sanitization capable, they should get disinfection every night using a heat cycle. And additional unannounced or unscheduled cleanings and disinfection should be done if one knows that there was a blood leak due to the membrane compromise of the dialysis filter, or if there was a blood detected in the dialysate effluent, or if the dialysis was done for an hepatitis B positive patient.